So welcome to the University of Calgary. I would like to take this opportunity to acknowledge the traditional territory of the people of the Treaty 7 region in southern Alberta, which include the Blackfoot Confederacy, comprising the Siksika, the Piikani, the Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Dakota, including the Chiniki, Bearspaw, and Wesley First Nations. The city of Calgary is also home to Métis Nation of Alberta Region 3. I would also like to know that the University of Calgary is situated on the land adjacent to Weatherbowl River, Mr. Elbow River, and that the traditional Blackfoot name of this place is Mokitsisai, which we now call the city of Calgary. So welcome. Today we have the privilege of having Velvet Whaling. Velvet is a pharmacist and she works within the cardiology team at South Health Campus for Alberta Health Services. She attended the University of Saskatchewan to obtain her Bachelor of Science in Pharmacy. She has a special interest in cardiology and diabetes and currently works at South Health Campus. So welcome, Velvet, and I'll stop my screen share and you can take it away.
My screen sharing is disabled, Camelia.
Try again, one more time.
There we are, thank you.
Okay.
Good morning. So the presentation that I'm going to be doing today is entitled Medications Used in the Treatment of Heart Failure. It is intended to provide general information for people who have been diagnosed with heart failure. And we're going to look at the different classes of medication used to treat heart failure, important drug interactions that you need to be aware of, and what you can do to ensure that you get the most benefit from your medications. It is important to recognize that there are different kinds of heart failure and that heart failure is a condition that changes over time. Your heart failure team includes you, your cardiologist, nurse practitioner, nurse clinician, pharmacist, dietitian, social worker, and psychologist. The team should work together to determine which medications and other treatment options will be best suited for you as an individual. Not all of the medication classes presented here are appropriate for all people with heart failure. Your current heart function, the symptoms of heart failure that you experience, your other health conditions, and your personal goals for care are all important considerations in determining which medications will be best for you. If you are pregnant, planning to become pregnant, or breastfeeding, your team will take special precautions to keep you and your child healthy. You are the most important person on your heart failure team. It is my goal that this presentation encourages and prepares you to be an active participant in your care. The medications that you will learn about today have been studied extensively in people with heart failure. With medication, we hope to prolong life or slow the progression of heart failure, improve the quality of life by controlling the symptoms that many people experience, such as swelling of the legs, abdomen, and fluid retention in the lung, fatigue, and feeling short of breath. We also want to reduce hospitalizations due to heart failure. For many of these medications, study results have demonstrated that there is a particular dose of that medication that provides the greatest benefit to the largest number of people with heart failure. This dose is called the target dose. Often, medications are started at a low dose to improve symptoms of heart failure with minimal risk of adverse events. Your heart failure team will monitor your response to the medication by watching for side effects and monitoring your blood. If you tolerate the medication well, the starting dose will be increased over time until the target dose is reached. If you should experience adverse effects or your blood work results indicate that your body cannot tolerate a particular drug, the dose may be decreased or the drug may be discontinued. Studies have shown that heart failure medications given in combination are usually more effective to prolong life and improve symptoms than using a single drug alone. The first medication class we're going to look at are called the angiotensin converting enzyme inhibitors, or ACEs, and the angiotensin receptor blockers, or ARBs. I've listed some of the names of the most popular heart failure medications that we use there, and a diagram of their activities. ACEs and ARBs interfere with the activity of hormones called angiotensin II and aldosterone. By blocking the actions of these enzymes, these medications keep the blood vessel open, they lower blood pressure and reduce the work that the heart muscle has to do to pump blood to the rest of the body. They also increase the loss of sodium and fluid through the kidney, reducing the risk that fluid will accumulate in the legs, abdomen, or lungs. The ACEs and ARBs have been shown to preserve kidney function, keeping them working as best as they can for as long as possible. You may be prescribed an ACE or an ARB. As the action of these medications is similar, it is rare that a person would take both of an ACE and an ARB at the same time. The ACEs and ARBs are considered to be very important medications in the treatment of heart failure because they've been shown to slow the progression of heart failure, prolong life, improve the quality of life, and reduce the risk of needing hospitalization. The ACEs and ARBs have some common side effects. A dry cough occurs in approximately 15% of people who are taking an ACE inhibitor. It usually does not occur in patients taking an ARB. The cough may be mild and go away after a few days, but often the cough or a dry tickle sensation in the throat continues. Talk to your heart failure team about switching to an ARB if you experience a dry cough. Cough suppressants that you can buy over the counter do not work to stop the cough caused by an ACE inhibitor. Dizziness or feeling lightheaded is common with most medications that lower blood pressure. These effects will often be more pronounced when changing positions, such as standing up from a sitting or reclining position, or while participating in activities that may lower blood pressure, such as exercise, a hot shower, or being in a sauna. It is very important to be mindful about preventing falls when taking medications that lower blood pressure, and we will talk about fall prevention in more detail later in the presentation. ACEs and ARBs retain potassium. They have the potential to cause a high level of potassium in the blood. The medical term for this is hyperkalemia. The ACEs and ARBs, because of their effects on aldosterone, cause your body to hold on to potassium that would normally be excreted or lost from your blood through the kidney. Do not take potassium supplements while you are taking an ACE or an ARB unless they are prescribed by your heart failure team. We will review hyperkalemia in more detail at the end of the discussion. Angioedema is an important side effect. It involves swelling of the lips, tongue, or face that might be accompanied by difficulty swallowing or difficulty breathing. It's a relatively rare reaction occurring in less than 1% of patients. But if it does happen, the patient must go to the emergency department or call 911 right away, as urgent medical attention is required. I'll talk about allergy at this time as well. Allergy is possible with any medication, and the symptoms may vary from person to person. Skin rash, itching, hives, fever, or chills are common. Speak to your heart failure team or your community pharmacist if you experience any of these reactions. If your symptoms are mild, they do not progress over 24 hours and resolve within 48 hours, you may be able to continue the medication. However, if your symptoms persist or they become more severe over time, your heart failure team will prescribe a different class of medication for you. The next medication we'll talk about are the angiotensin receptor neprilysin inhibitor, or ARNI. This is a combination of two medications, valsartan, which is an ARB, and sacubitril, which is a neprilysin inhibitor. Currently, there is only one medication in this class, and you may be more familiar with the brand name Entresto. Neprilysin is an enzyme that breaks down natriuretic peptides. By preventing neprilysin from working, these neprilytic peptides stay active in the blood longer. The natriuretic peptides are helpful in the treatment of heart failure because they help relax the blood vessels and increase fluid loss through the kidney. Entresto is an important medication in the treatment of heart failure because it reduces the risk of death and hospitalization due to heart failure. Your heart failure team will help you to decide if an ARNI would be a good choice for you. If you're taking an ACE or an ARB, you must stop that medication before starting the ARNI. Taking an ACE or an ARB with an ARNI dramatically increases the risk of adverse events such as low blood pressure, high potassium levels in the blood, kidney dysfunction, and angioedema. Beta blockers. There are 3 beta blockers used to treat heart failure: metoprolol, carvedilol, and bisoprolol. Beta blockers relax the heart muscle, slow the heart rate, and lower blood pressure by blocking the effects of stress hormones on the heart muscle and the blood vessels. Beta blockers are very important because they slow the progression of heart failure and prolong life. They can improve the function of the heart muscle over time and improve the quality of life for patients taking this medication. It is very important to note that once you start taking a beta blocker, you should not stop taking it abruptly, as you may experience a dramatic increase in blood pressure, heart rate, or heart failure symptoms. If you need to stop taking a beta blocker, your heart failure team will help you to wean off the drug slowly and safely. Common side effects of beta blockers include dizziness due to the effect of the drug on heart rate and blood pressure. Monitoring your blood pressure and pulse when you're taking a beta blocker is very important. Seek medical attention right away if you feel faint or collapse, as this can indicate a progressive or new, more serious medical condition. Fatigue or feeling low in energy is very common with most of the beta blockers. Fatigue presents the greatest difficulty in the first 1 to 2 weeks after beginning treatment and when the dose is increased. After 2 weeks, most people begin to feel better and notice that both their energy level and the symptoms of heart failure are improving. Exercise, good nutrition, and rest will help you get through this initial period and help you to persevere with treatment until you begin to experience the benefits that beta blockers can provide over time. Changes to your mood, depression, anxiety, nightmares, difficulty sleeping, and loss of sexual desire These effects may be due to the beta blocker, or they may be due to the knowledge that you are adjusting to the experience of a new health condition. If these effects are due to the medication, switching to another drug in this class may be helpful. Be sure to discuss these effects with your heart failure team, as they can provide guidance and resources to help you manage this part of your treatment. Shortness of breath or difficulty breathing may be mild and subside in a few days. People who have a history of asthma and other kinds of breathing problems may be more susceptible to this effect and will require careful monitoring. Numbness, tingling, or feeling cold in your hands and feet. People with peripheral vascular disease or poor circulation are at greatest risk to experience this side effect. Speak to your heart failure team about the best way to manage this if it is a problem. A special note to people who have diabetes. Beta blockers can hide the signs of low blood glucose, such as shaking and rapid heart rate. You may still experience other signs such as sweating and hunger. If you have diabetes, be sure to discuss blood glucose management while taking beta blockers with your heart failure team. The mineralocorticoid receptor antagonists, or MRAs, include spironolactone and eplerenone. These medications block the effects of aldosterone on the kidney. This action causes two things to happen. Increases the amount of sodium and water that leaves the body through the kidney, and it increases the amount of potassium in the blood. The MRAs are important for heart failure treatment because they improve symptoms of heart failure, such as swelling in the legs and abdomen. They reduce blood pressure and make it easier for the heart to pump blood to the rest of the body. They reduce the risk of hospitalization for heart failure, and they have been shown to prolong life. The most common side effect of the MRAs are dizziness due to the drop in blood pressure. And similar to other medications like ACE inhibitors that block aldosterone, the MRAs retain potassium and can cause high potassium levels in the blood. Nausea or loss of appetite can occur, and it's important to take medication with food and maintain good nutrition. These side effects usually occur at the start of treatment, but diminish after a few days. Breast tenderness or breast development occurs in approximately 10% of men who take spironolactone. If this occurs, talk to your heart failure team, and they will discuss switching to eplerenone, which doesn't seem to have this side effect. Breast tenderness is much less common in women, but menstrual irregularities can occur. The diuretics are commonly referred to as water pills. Some of the names are listed there. You may be most familiar with furosemide and metolazone. These medications help your kidneys get rid of extra fluid and sodium through the urine. Diuretics are beneficial because they can eliminate swelling in the legs, abdomen, and lungs. It is best if these medications are taken in the morning or early afternoon so that people are not up all night in the washroom. The dose of your diuretic medication will be adjusted so that you have the greatest potential to maintain your dry weight. People with heart failure often carry excess fluid in the legs, abdomen, or the lungs. Retaining fluid will increase your weight quickly within 1 to 2 days. Your dry weight is the weight you are when you have no swelling in your legs or abdomen, a stable blood pressure, and you do not feel short of breath. It is often the weight that allows you to feel well and to be active. Your heart failure team will work with you to determine your dry weight and give you guidelines for monitoring diuretic dosing to stay at your dry weight. The most common side effects of diuretics are nausea, dizziness due to a drop in blood pressure, low potassium levels in the blood, The medical term for this is hypokalemia. And dehydration can also occur with diuretics, particularly if you are unwell, if you spent time in very warm environments, or you've made changes to your exercise routine. We will discuss hypokalemia and dehydration later in the presentation. Hydralazine and nitrates are used in combination. Nitroglycerin comes in various different forms, and your heart failure team may prescribe a patch or an oral tablet. Hydralazine and the nitrates open the blood vessels to lower blood pressure and to supply more blood and oxygen to the heart muscle. This combination reduces the work on the heart muscle and it improves exercise tolerance. Sometimes hydralazine and nitrates are used in place of an ACE inhibitor or an ARB for patients that do not tolerate those medications. Headache is a very common side effect of the nitrates. It usually goes away in a couple of days as the body develops a tolerance to the medication. Dizziness can occur due to low blood pressure. Flushing or a feeling of warmth in the face or neck can occur, and it's usually reduced by taking the medication with food, as is stomach upset or nausea. The side effects of hydralazine and nitrates can be uncomfortable, but these medications can be very effective in managing symptoms. So be sure to talk to your heart failure team about suggestions to manage these effects if they are interfering with your daily activities or your quality of life. If you experience falls or fainting, numbness or tingling in your hands or feet, it would be important to communicate that to your physician or go to the emergency department right away, as these effects can indicate a more serious adverse reaction or a new medical event. The sodium glucose cotransporter 2 inhibitors, or SGLT2 inhibitors. The most common brand names for this class are Jardiance, Forxiga, and Invokana. This is a new and very exciting class of medications that have shown significant benefits for people with heart failure. The SGLT2 inhibitors are also used to treat diabetes. Studies to determine the full benefit of these drugs are still ongoing, but we do know that they increase the excretion of water and glucose through the kidney. They reduce blood pressure, reduce fluid retention or swelling, and they have beneficial effects on the blood vessels and the heart, as they lower the risk of death from cardiovascular disease. They've also been shown to reduce the risk of hospitalization for heart failure, and they preserve kidney function. The most common side effects from SGLT2 inhibitors are urinary tract infection, vaginal or penile yeast infections, and low blood pressure. The risk of these side effects can be minimized by practicing good hygiene and fall prevention precautions. This class of medication has the potential to cause other, more serious adverse events, but your heart failure team will discuss the benefits and risks of SGLT2 inhibitor medications in detail, as well as the guidelines for monitoring the effect of these drugs before you begin treatment. Digoxin is a medication that has been around for many years. Digoxin slows the heart rate and it improves the efficiency of heart muscle function. Digoxin is also used to control irregular heart rhythm in atrial fibrillation. Digoxin improves the symptoms of fatigue and weakness, and it reduces swelling in the feet and ankles. It's been shown to improve or control heart failure symptoms, but it does not prolong life. Your heart failure team will monitor your dose and response to digoxin very closely. Taking the proper dose of digoxin is important because too much digoxin in the blood can cause toxicity. Some signs of toxicity are loss of appetite, nausea, vomiting, or diarrhea. severe fatigue or weakness, loss of balance, change to the walking gait or falls, confusion, changes to behavior, or changes in vision, such as seeing halos around lights, green or yellow vision, sensitivity to bright light, seeing flashes of light, having blurred vision, and in some severe cases, hallucinations. These effects will not go away over time and will become worse if they're not addressed by lowering the dose of digoxin or stopping the drug. Be sure to get medical attention right away if you experience any of these adverse effects. Ivabradine or Lancora is a medication that slows the heart rate by inhibiting the electrical current made by the heart's natural pacemaker. In heart failure treatment, this is helpful because it reduces the work on the heart muscle to pump blood to the rest of the body. When used in combination with other heart failure medications, it's been shown to slow the progression of heart failure, improve heart failure symptoms, and reduce the risk of hospitalization. The most common side effects of ivabradine are a slow heart rate causing fatigue and dizziness. It's very important to monitor your heart rate and blood pressure closely when taking ivabradine. Your healthcare team will order a test to check your heart rhythm before you start the medication, whenever a dose adjustment is made, and periodically through the course of treatment. Vision changes, which include blurred vision, bright spots of lights, halos around lights, or flashes of color or patterns in your vision, is temporary, and it occurs most commonly in the first 60 days of taking the drug. It can be usually well managed by wearing sunglasses when outdoors. Nausea can be prevented by taking the medication with food. This next section, we're going to focus on drug interactions that can occur with your heart failure medications. The first class is the non-steroidal anti-inflammatory medications, which include things like ibuprofen or naproxen, the brand names being Motrin, Advil, or Aleve. The drug interaction also includes things like salicylates or aspirin, which we say is other than the low dose aspirin that you may have been prescribed as part of your cardiac treatment. These medications decrease blood flow to the kidney, which results in fluid retention and an increase in blood pressure, which automatically increases the work on the heart muscle. Taking these products can cause an acute episode of heart failure and can result in hospitalization. The NSAIDs and ASA will increase the bleeding risk that's associated with antiplatelet drugs such as clopidogrel or ticagrelor, and the anticoagulants such as warfarin, apixaban, or rivaroxaban. It's important to talk to your heart failure team about any of these drug interactions when starting a medication. Decongestants include drugs like phenylephrine or pseudoephedrine that may be found in many cough, cold, or allergy medications over the counter. These medications close the blood vessel, increasing blood pressure and heart rate, and increasing the workload on the heart. They can counteract many of the prescription medications that are prescribed to treat your heart failure. Herbal medication, traditional medicine preparation, botanicals, THC or CBD. The manufacturing process and quality control standards are not strictly regulated in Canada as they are for prescription drugs. Products may not conform to the contents that are stated on the label, and there is a risk of contamination that may pose a risk to heart function. The claims made about a product may not have been studied, or the limits of safety and effectiveness may not be known. If you're interested in taking a herbal supplement, I recommend that you talk to your heart failure team so that a drug interaction screen can be done to assess the safety of the product before you start taking it. Alcohol is toxic to the heart muscle and may interact with some prescription drugs. You may experience more adverse effects such as dizziness, confusion, or falls. If you have diabetes, alcohol can influence blood glucose levels. It is important to be aware that alcohol may increase the risk of bleeding associated with anticoagulant or antiplatelet medications. So ask your heart failure team about how alcohol may affect you and develop some guidelines for acceptable use before consuming alcohol. Prescription medications. Before starting any new prescription medication or adjusting the dose of a medication you are already taking, ask your heart failure team about potential drug interactions or an increase in side effects that you may expect. Having this knowledge in advance may help you to monitor your health more effectively and prevent an adverse event. Some classes of medication that have a greater potential to interact with heart failure medications include antibiotics or antifungal drugs, pain medication, anti-inflammatory medications like prednisone, drugs that are used to treat depression, anxiety, or other mental health conditions, diabetes medications, and those used to control seizures. Men, it is important to note that medications used to treat erectile dysfunction may interact with some heart failure medications to dramatically lower blood pressure. Do not take these medications until you have discussed it with your heart failure team. Perhaps the information about heart failure medication is new to you. The benefits sound good, but you are concerned about the side effects. You want to be safe. You may ask, what can I do to get the most benefit from my heart failure medication? The first thing is to know your medications and take them as prescribed. Ask your heart failure team to help you prepare and maintain an accurate medication list. Be sure to include vitamins and over-the-counter medications on your list. Ask your community pharmacist about receiving your medications in a blister pack that they prepare for you, or consider using a dosette or another kind of pill organizer. Be aware of the drug interactions that we spoke about earlier and include your heart failure team in discussions to minimize your risk of adverse events. Know what to do if you miss a dose of medication. For medications that are prescribed once a day, if you remember within 12 hours that you missed your dose, you can take your dose and resume the next dose at the next scheduled time. If you do not remember within 12 hours, skip the dose you missed and resume taking your next dose at the scheduled time. For medications that are prescribed twice a day, if you remember within 6 hours, take your dose and resume your next dose at the next scheduled time. If you don't remember within 6 hours, just skip that dose and resume taking your next dose at the next time. Never take 2 doses of a medication at one time, as this may cause adverse events such as a significant drop in blood pressure or heart rate, dizziness, or falls. If you have questions about a missed dose, contact a member of your heart failure team or call your community pharmacist for guidance. Follow the limits for salt and fluid intake given to you by your heart failure team. People with heart failure are frequently advised to limit the amount of fluid they consume to 1.5 to 2 liters per day, and their salt intake to less than 5 grams or 1 teaspoon a day. Not all people with heart failure will require fluid restriction. These guidelines are important to control blood pressure, reduce the work on the heart, and minimize the potential to develop swelling in the legs, the abdomen, and the lungs. Consuming more fluid or eating food that's high in salt can quickly cause the body to retain water and lead to an acute episode of heart failure. Fluid retention may require treatment with intravenous diuretics or hospitalization. Weigh yourself first thing in the morning after using the washroom and record the result. Monitor and record your blood pressure and pulse as well. Know what your dry weight is and follow the diuretic dosing plan provided to you by your heart failure team. Do not hesitate to contact your heart failure team if your daily weight is increasing quickly or if you find that you're not responding to the diuretic doses that you have prescribed. Remember to bring your records with you to your appointments. Your heart failure team will ask you to go for blood work to check your kidney function and electrolyte levels. This is important because these results will help the team understand how your body is tolerating the medication and if it is safe to continue the medication or increase the dose. Fall prevention precautions are very important. Many of the medications used to treat heart failure have the potential to lower your blood pressure, cause dizziness. Fatigue caused by the medication or by heart failure itself may increase this feeling of being unsteady on your feet. It is important to practice fall prevention precautions to reduce your risk of suffering the consequences of a fall. What can I do to practice fall prevention precautions? Be mindful and aware. Move slowly when changing positions. Sit at the edge of the bed or the edge of the chair and be sure that you feel steady before getting up from a reclining or a sitting position. Stand up, be sure that you're steady before you begin to walk, and then start to walk. Don't be bashful about using a cane or a walker for support. These can be valuable tools to avoid injury and to maintain your independence. Your body may take several days or several weeks to adjust to the effects of a new medication or the effects of low blood pressure. It is important to note that you may experience dizziness when you start a medication and again when the dose of the medication is increased. This chart is taken from the Canadian Deprescribing Network website. This is an organization that advocates for safe and effective medication use. I hope that these suggestions related to fall prevention will help you stay safe and independent. It's recommended that you keep your vaccinations current. Having a chronic condition such as heart failure may put you at greater risk of developing infections such as influenza and pneumonia. The illness course and long-term consequences of some infections may be more severe in people with heart failure. Getting vaccinations at the proper time may prevent the infection from developing or may reduce the risk of severe illness if you do become ill. Ask your heart failure team which vaccinations are recommended for you. If you experience vomiting, diarrhea, fever, or if you're unable to eat or drink fluids as you normally would for more than 24 hours, contact your heart failure team and make them aware. Some medications listed here have the potential to cause kidney dysfunction if you become dehydrated. The ACE inhibitors, diuretics, angiotensin receptor blockers, and SGLT2 inhibitors are all important medications for people who have heart failure. Your heart failure team will be able to advise you about what to do with your medications and whether or not you should have additional blood work done to monitor your kidney function and to keep you safe. The next 3 slides are more details about high potassium and low potassium levels in the blood that can occur because of the medications that you take or dehydration. Ideally, you would recognize what these symptoms are and contact your heart failure team or your physician if they are part of the adverse effects that you're experiencing. For high potassium in the blood, your heart failure team will advise you if you need to restrict potassium-rich foods from your diet. We don't ever want you to take potassium supplements unless directed by your heart failure team. If you experience the signs of dehydration, we would like you to notify your heart failure team or seek medical advice right away. The diuretics and the MRAs pose a greater risk for causing dehydration, and some people are more susceptible to dehydration than others. I hope that you found this information helpful and that you feel more informed and prepared to participate in your care as someone who has heart failure. We'll now have some time for questions.
Thank you, Velvet. That was really a great presentation, very informative. I'll stop the recording now and we can start answering some questions.